Mtazamaji, hivi sasa tunakatiza kipindi chetu cha Sema na Citizen. Tuelekee katika hospitali ya rufaa ya chuo kikuu cha Kenyatta, ambapo hivi sasa waziri wa afya Aden Duale pamoja na viongozi wanaosimamia SHA wakiwa wanaongoza shughuli muhimu ya kuanzisha matumizi ya kieletroniki kuhusiana na usajili na vile matumizi huduma zitakazotolewa katika hospitali zote ambazo zimeorodheshwa katika level 4 na level 5 kutumia mbinu na mfumo ya kieletroniki. Shughuli hiyo inafanyika sasa na itaendelea kwa muda wa nafikiri saa 1 hadi pengine saa 5:30 hivi, ambapo shughuli hii inatazamiwa kukamilika. Hebu tusikilize na tufuatilie yanayoendelea.
Naweza kuona kama hii machine ya billing inafanya kazi. I don't see it's working. Can you serve a patient? Call one for me. Okay.
She's a patient. No, you're a patient.
Karibu.
I'm fishing with her.
Okay, deal with her.
Waziri, you can go in that way. Yes. You can follow
What do you want him to say?
Is it faster?
Yeah, it's faster.
It's very good, very good. How many minutes do you stay with the patient?
Maybe the longest is 5 minutes.
5 minutes, good. Who are you?
Yes. City. Kuna forms umejaziwa? Kuna lakini sijaikuta hapo. Namba 13. Lazima ukuje na forms.
Tafuta mtu akona forms.
Somebody who has a form?
Somebody with a form? Any form ya SHA?
This is a form for SHA.
Diagnostic imaging.
Yes.
That's pre-authorization.
So this is a pre-authorization form and this is the claim form.
Yeah, but I was told now the biometrics, you will not require pre-authorization.
If the doctor is going to do...
For biometrics, we're just changing from OTP to biometric.
Yes, so you don't need OTP?
We don't need OTP.
Okay.
We've already installed them, and trained them, and we've been using in the facility.
Okay.
So we just need to see a patient using the
Real form?
Okay.
Yes, there's another one. There's another one on top of this. There's another one like this.
Okay, can we do identification to see
Yes.
patients?
Yeah.
Just do the biometric.
Let's do the
Just
identification.
ask for the
Just
ID
give me
number.
ID number.
ID.
Yes. And you give me the physical ID also, because I need to scan it. ID copy, mama. ID copy kwanza.
Tuambie ID number.
ID mama.
22 62 65.
6265. Haijaja. 2260.
No, your number hajaja. 2265. Yeah.
Susan.
Yeah.
Yeah. Susan Wanjiku Nana. Very good.
Nafanya verify.
Left index. Left index.
This one.
Just call direct to OTP. Why is it? Just one direct to OTP.
Okay.
So many minutes.
She has not. So we need
So
identification.
we just need OTP.
Okay.
Give us another patient, but it's okay now.
Okay, good. Tunaenda wapi? It takes about 5 minutes. First day.
Then we have now other outpatient centers, about 1,000 patients. Every day are some patients, but every week, every day, we have 450 to 500 inpatients. So this is our community area. It's a bit congested, but we need to open our new oncology center.
Yes.
Very well. Yes. We're going to start the patient
Yes.
at eligibility.
Yes.
That's where we check whether their fingerprints, they have registered for SHA.
Yes.
So we already have a patient waiting.
Yes.
We just wanted you to experience
Okay.
what that goes.
Go
ahead. Go ahead.
Fine.
So here we confirm eligibility for patient.
Yes.
Yes, once we have like this one, we go to SHA portal.
We can't hear you.
Okay, we go to SHA portal
Yes.
for confirmation of eligibility. Once we insert the
But already you have Vincent there. Or you put his ID.
yeah.
Okay.
Once we view, we see the Vincent is eligible.
Vincent Mudoni.
Yes.
Is that your name?
Biani.
Biani, hiyo ndio yako, si ndio?
Yeah.
Imetoka.
Once
Next.
it's eligible, we proceed with our service.
So ukitoka hapo CS.
Sorry? Akitoka hapo, we proceed and go and see the doctor. From their prescription, we proceed to billing, pharmacy.
Have you taken his biometrics?
Biometrics, yes, we can.
Oh, you have already done before we came.
No, we can
Can
do
you
it.
get out and do it again so that this
Yes,
is
yeah.
Yeah.
Yes.
I'm here because of the biometrics. And this is why you initiate the patient.
Yes.
Yeah, and make sure the patient, you initiate the patient from the beginning to the end.
Correct. So without this going well.
The owner of this system is here. There's no reversal, am I right? You can't bring it back.
No.
So initiation must...
So it's ready for scanning.
Put your right finger.
Randomly chooses a finger, then it turns on. Or it randomly chooses the finger.
So that would have.
Yes.
Now it is.
Success.
Yes.
Thank you.
Thank you.
Please don't check don't take the details of the patient. In the media.
Please don't, yes, please media don't capture that.
Yeah,
We
don't
want
capture,
you to-
yes.
Yeah.
That's the privacy.
Yes.
All right. So CS.
Thank you.
Then.
Let's have a few people going in, please.
She was about to finish.
Okay.
We'll start with him.
Okay.
Karibu. Mami kidogo tatupisha, tuwe na yeye tafadhali.
Umemaliziwa?
Tunaomba kidogo.
Dakika moja.
Dakika moja.
So Waziri, as is explained here, you will see that the doctors are
Yes.
also being used for approval.
Yes.
Where the doctor is linked to this facility.
Uh-huh.
If you are away from this facility, you will not be able to approve the doctor.
So this is for the pre-authorization for the doctor?
Yes, the resident by using the doctor's app, which is linked and geofenced to this facility.
Okay. So you can share his, now sharing a lot.
There is no sharing of the code, and he can't approve if he's out of the hospital, the radius of the hospital.
We have submitted our codes and it is active. Okay, PDC code.
You are on the summit here.
Yes.
He's Dr. Abed, who is our head of oncology.
So once the patient comes here, the first thing we go to the claims, then we search the patient's name. Is here. Okay. Yes. So then after here, we are going to add the diagnosis of the patient.
Towards the end.
Tunatibu nini? Tunatibu nini saizi? Which cancer are we treating? The tongue, yes. Yeah, so we come here to the system, the patient's details. So after we confirm that the patient details everything, we go ahead, we prescribe here.
So Waziri, you can
So
see
here,
when he types there,
yeah,
it pulls all
the cancer sheet he's having.
Okay.
That is pulling from our terminology.
From the terminology.
Yes, to ensure that the terminologies are correct for
Yeah.
each and every facility.
So
So that's
like-
one use of the terminology.
Yeah. So for him, we are confirming the diagnosis to
Yes.
be the cancer of the tongue. Then after that, we are able to save the diagnosis.
And you can see it's reducing a lot of doctor typing.
Yeah.
Yes.
So next,
Paperwork.
so next we'll go to prescription. Now we'll prescribe the chemo he's getting.
So when a claim is made to SHA, all these details of the doctor, that's to be seen in the system. That's
So even as he's doing this SHA,
Yeah.
he's able to see it.
on the other side. Real time.
Yes. So now you're prescribing.
Yes, I'm supposed to prescribe and pull the name over here.
The name is Joseph.
Joseph.
Type.
Yeah.
Can you give the names?
Our team, where's our team? Yeah, I'm not able to. I'm not to pick the name.
Just find the name there.
Where? From the claims or from the prescription? From the claims.
Yes.
Joseph.
You can check it as well.
So you have to do all the three names.
Yeah. So it's already here. So we have already put the diagnosis already. So now we are supposed to put the chemotherapy medicines.
So just go and scroll down. Click there, you're prescribing for medication.
Yes.
So you opt in and you say, yes, I'm prescribing.
Yeah. So after here, I'm going now to prescribe the medications which I want to give to the patient. Yeah, at prescription. Then I'll come
Scroll
down here and put the medication. For example, this patient will need cisplatin. So I'll just type cisplatin and the system will be able to give me the name of the drug over here.
So Waziri, that pulling is a product catalog.
Okay.
You can see it's already realizing that prescription is within the approved product catalog for PPP.
The one we are launching today.
Yeah. So
what about if we put a prescription which is not in our catalog?
You will not find it there.
Okay.
You can't
I bet you can put one of the newer drugs that is not captured by PPB.
okay, let's say for example, yeah.
Okay.
Okay. So for example, let me put here.
Not yet approved by
Yes, not yet approved by PPB.
by pharmaceutical
Yes.
poison. Okay.
Like the one we are trying to use for
Go.
Okay.
any that you can think.
Okay. I'm trying to think the one that's still in pipeline.
Thinking. Yeah.
What was Mercy using? Mercy's baby.
Can I help you?
Any drug which like in
Drug that's
pipeline.
not in PPB now.
Huh? No, that is there.
That one must be.
Yeah.
Yeah, it must be there.
Facility.
Try it.
Just try.
Yeah. Okay.
Has been lost.
No, because it was withdrawn. It was withdrawn. Yeah.
That's a good one.
Yeah.
Try it.
Yeah. So it is showing here. It's
No
not,
results.
no result is found. Yeah.
So we
You
cannot
can-
prescribe.
We cannot prescribe something which is not available over here.
And has been withdrawn.
It has been withdrawn. Yeah.
PPB has withdrawn.
Withdrawn is that's why it's not appearing.
So in this case, even if you prescribe this drug, first you can do on our system.
Yes.
Two, if you prescribe, then SHA will not pay.
Yes.
That's the main.
You can't use
So there is one point.
That's number one.
The upper
Yes.
And if you do it manually,
The doctor's app.
But ultimately, again, even if you give and then claim, SHA will not pay.
You can cancel it.
So let me
So there
just...
is one point to be
So
demonstrated.
yes, so now
Yes.
I'll prescribe the drug for him so that my colleague can be able to show the next step.
Okay.
Space.
No, it is okay. I think the system is looking, yeah, searching. Yeah, it's searching, yeah.
The next step was once they prescribe and
Yeah, so here
submit
it
the
is.
SHA for pre-authorization.
Yeah.
Now it comes to the app. So now the app is authorized.
So like for him, we're prescribing the dose. Let's say I will put 60 milligram. So here the dose will be 60 milligram. And how frequent am I prescribing it? Every 1 week. So every 1 week, I'm going to choose here 1 week for only 1 day over here. So instruction for use, we want it, let's say after meals. Then is instruction, then you say hydrate the patient. Then take as prescribed. So the pharmacist has to take my instructions according to how I've prescribed the medications over here.
And CSR, that is important.
Yes.
The doctor owns the process of prescription, so that when the pharmacist, they just look at the instruction from the doctor and dispense as per that prescription.
Yeah. So next step, I'll get an SMS to confirm, whatever I've ordered here.
Yes.
So to avoid any form of fraud. So I'm now going to get here an SMS. Okay, has been saved. I'll pass it?
Yeah.
Yeah. So it is already registered here now in the system. Yeah.
Search. Up a bit. There. Search.
Yeah, so I have to put my details. So I put here, I choose KMPDC, so it can either as a doctor, as a clinical officer, or as a nurse. So being a doctor under KMPDC, then here I'll put my number.
So was it also there, if you don't have an active license, you will not be able to?
Yeah, so here it brings my name. Then I confirm this is me prescribing the medication. I
That's
choose
Abid?
Yes.
Okay.
Yeah.
And that is what?
Scroll.
Yeah, so here now the OTP is supposed to be
Scroll down.
to come.
Keep scrolling. Scroll.
Yeah, so here I'm going to send an SMS. So I'll confirm my mobile number over here.
And the mobile number is already...
So here it is already informing me SMS has been successfully sent to my number.
So now we're waiting for you to receive on your phone?
Yes. Yeah. So now I've already received SMS over here. So the SMS is giving me instructions. Do I need to approve? Do I need to approve or to reject?
Dr. Abeid Mohammed, you have new prescription request from Kenyatta University Teaching and Research Hospital on this date, at this hour, for Joseph Mbuthi Macharia of this particular drug. Reply with the DS11 to approve or DS10 to decline. For details, contact SHA on 147.
Yeah.
So
from this step now I'm going to approve.
And then as you scroll down, so the status will refresh to pick up that new approval.
Yeah, so you have approved from your phone?
Yes, I've approved from my
so
phone.
So you're saying
DS11.
11.
It's 11 to say it's like it's yes.
Okay.
Yeah. So once I approve, now I'll get a notification in the system. It has been approved.
Refresh.
So I have. Yeah. So I'll refresh here.
Scroll to the prescription bit. Scroll up a bit.
Yeah, it is loading. Yeah. So here you can see the name, the diagnosis.
It's just up a bit. It's loading.
Yeah. It is loading. Yeah. Prescription already prescribed.
Yes.
So it means now the patient is ready to move to the next step, which is the pharmacist.
Prescribed means SHA will not pay. Yeah, because Mercy will see that this patient was not given the prescription. So you can't claim to give us a whole claim, and you have not prescribed for medication.
But is there a way you can find out that the patient picked the drug?
At the dispensary.
Okay.
You go to the dispensary.
Yes.
The doctor.
Okay. Okay.
So this is what where the magic happens.
Yes.
So for the prescription for the same patient, I believe.
Yes.
I should be having. So I come to prescription. I've been sent for the name, but at that time the patient will be in front of me. Joseph. Here he is.
Yes, Joseph is there.
And then it's today's date. We view the patient. Do you? Yes, it's me who's dispensing.
How do we know you're a qualified pharmacist? From the system. I'm not saying you're not. I'm not saying you are qualified, but the system, because that's what we had. But I bet had to put his KPNDC number. Am I right?
Okay, yes.
So at the
dispensing, either the nurse or the pharmacist should put their number, and then we pull up the PBB from the nurse account.
Okay, so it's enabled to work because for me they've already created for me an account. I think I've just
already account created for you.
For SHA, yes.
Okay.
Yes.
So you already have an account.
So yes, this is actually my account.
Okay.
Yes. So from here, I'll come and the patient has been dispensed for. I can see cisplatin, whatever the drug is. That's fine. So the branded name, of course. Since for me, I would probably already know what I have from the shelves, because here now it is asking for the brand name. Just as they said, PPB will have the portal of the approved. As much as it's the generic name, yes, we also need the brand name.
Okay.
Yes. So from here, if this one is approved. So you see, I'm trying something that is not. This is just a random brand name.
Yeah,
you see, it has not come up, and this is a brand name that is there in the market.
Yes.
Yes. So
and
you see,
approved by PPP.
So clearly, if it has not come up, it is not approved.
So what she's saying, Cisplat is actually a brand that is there in the market, but has not been approved by PPB. So if you try to dispense that through system, it won't accept. It has not been approved by PPB. Even for the same medication that was approved, but that brand name has not been approved.
So this one, you pick what has been approved, and then now the quantity, depending on the prescription from the doctor.
From the doctor.
So you say quantity 2, and then I'll have to enter the price. At that time, of course, we have a price checker because our system is not manual. Of course, we have our price checker. I will go online. I'll still have to log into my now work portal to confirm the price of the drug.
Yeah, and that's why the integration is important. And we're already working with the DHA team to integrate so that in future she does not have
I don't have to open another one.
It becomes
I don't move to another.
Yeah, so when I stop oscillating.
Once it is fully integrated, we don't have
you
to
do that?
Yes. This is the first one.
We are working with them to do integration.
Good.
Thank you.
Well done.
Thank you, sir.
Well done.
We go to billing, sir.
Okay.
Yes. So all the good work is done. Now we need to send it to SHA.
Okay.
To see whether they have money in the account.
Yes.
We have about 400,000. So
how are you?
So it's this way.
Bas. Msikia amesema bas.
In your life.
Oh, ndio.
Last you put your fingerprint. When the patient comes, you verify on the SHA portal. Once you verify.
Now you have used the ID card number.
Yes, I've used the ID card number.
Okay.
After verifying, the patient has come for oncology treatment for chemotherapy. So it's an elective prioritization. You go to elective prioritization, you request a prior. So we want to verify biometrics with her if she is captured under biometrics. So these are DK's procedures, so it's under outpatient services. So we go direct to biometrics, then I proceed. Then the patient will present fingerprints. So these ones, I see they're already captured.
Already seen.
Yeah, she's already verified from the registration. So I will use another case for approval. Yeah. So, Apisa, you can have a seat. I'll have this. I'll call you. So
ongea Kiswahili wengine hata
Julius.
Mara nyingine changanya.
Julius, get him.
Wapi Julius? Julius, karibu.
So for Julius, yes. Once we verify for this APISA, it will start a visit from here. So once you start a visit, that's where you will get to Julius. That's because we had already started his visit. So we'll go to pre-authorization, which for his case, it has already been done. Yeah, we had done it.
So what do you want to demonstrate now?
I want to demonstrate the portal on how we feed in the information. Then we'll get another, I have another one that already has an approval where we key now the prescription part.
Okay,
yeah.
Very good. Continue. The biometrics are working?
Yeah, they're working.
There are some of the officers. They have been trained. Make sure you attend to our patients. Mariana? Sigonge watu wewe. Sigonge wagonjwa. Mariana? Niwachilia mapema naenda kwa
Usikie gani? Gonga zaidi. Straight.
He told me he has finished.
Thank you. We'll put a plaque next time you see. So this is our integrated molecular imaging center. We see we do PET scanning and PET scanning here. We also produce the radio isotopes here also. Our billing for this is on this end. There are patients, around 20 patients who are there, but we thought we'll just demonstrate here with a patient. This is one of our patients for this morning. And I'll hand over to Fred.
Fred?
Yes.
Endelea.
Yeah, this is Fred. I'm Mick. This is where we do PET scan. Now, first we start with the verification of the patient using the ID, which he has provided. I'll key in the ID for the details.
Anthony, where's Anthony? I'm Boniface. I thought you told me you don't carry anything, including ID card. So why can't you use biometric to identify the patient? Okay, or first you pull it?
Yes.
Okay.
Yeah. So here it picks the PET scan. Yeah.
Our patient.
Biometric.
Eligibility look.
Oh, she's already done? Okay, she already did. Okay, she came in the morning. Okay, these are patients that have already done biometric scans.
Yes. Do we have a patient who has not done biometric?
Do you have a patient who has not done? Dr. Harish, do you have any of the patients out there who has not done?
Who has not done biometric?
Again.
Yes, one of the things we are cognizant for our oncology patients is also their fingerprints. With discussion with the DHA, that is one of the things, even when we make biometrics compulsory, they keep in mind that, yes, can we have some other form of biometrics?
Okay, okay. I think we come and see. We can continue.
Yes.
Let's continue.
Thank you. This ends the actual tour. Now we will
Okay.
We have just concluded a brief tour of the hospital, looking at the functionalities, and we want to invite you to address press. But before we do that, Waziri, allow me to just introduce the CEOs who are here. First and foremost, I will introduce the CEO of the Digital Health Agency, who that we are launching today. Dr. Engineer Anthony Lenayara is here. We have CEO of Social Health Authority, the user of the system. You know Dr. Masi Mwangangi. We have the CEO of Kenya Medical Supplies Agency, Dr. Wako Edjesa, who is also a user of the system. The CEO of Kenya Medical Practitioners, Pharmacists and Dentists Council, Kenya Medical Practitioners and Dentists Council, Dr. Kariuki, who is also with us. And then we have the host institution. We have the chair of the institution, Senator Kembe Gitura, and the CEO, Dr. Zainab. I think I will just allow the chairman to just welcome us before I invite Waziri.
Well, thank you very much, Bwana PS, our Cabinet Secretary, Aden Duale, and all the people that are present this morning for this very auspicious occasion. This is the unveiling, the countrywide biometric verification method unveiling by our Cabinet Secretary, Honorable Aden Duale. And as a chairman of this hospital, I must say that I feel very proud and honored on behalf of all the people that work in this hospital, the board, the management, that the Cabinet Secretary chose our hospital for the launching of this very, very important biometric verification method. He's gone through the hospital, we've taken him through a walkthrough of the hospital, billing, and all other places that he needed to see. And I'm happy that, in his own words, he is happy that he is here this morning for this purpose at this hospital. It is not my day to say too many things. Mine is to welcome our Cabinet Secretary to this hospital once again. He's been here not so long ago. He planted a tree. We are going to do a plaque in honor of today. And only just to ask him once again to remember, like I've mentioned to him so many times, that this being a level 6 hospital, there are so many needs that we need to have. I'm happy that he is proud of what we are doing here, and that he recognizes the effort we are making towards making this a premium level 6 hospital, a true referral hospital. There are many issues that beguile us, things that we need to do, and he understands them. The cancer center is one of the most important parts that I've been discussing with the CS, and I'm sure that you remember to help us to achieve the goal that we have, to have this as a truly referral hospital where we shall keep Kenyans and regional patients from going away to European and Asian countries for treatment. Our goal is to have this as the end place where patients will be treated and they go home cured without the need to go outside of the country for treatment. All of you can imagine the amount of savings that we are talking about, the amount of satisfaction from the patients, and our pride as a nation when we become a regional hub for medical purposes. So once again, it's a very important day this morning for us at the hospital, and I want to thank everybody who's made this a success and to promise that we are going to continue. This is not an event, it's a process. We are going to continue to make this hospital the best referral hospital, not just in Kenya, but in the region. Now I want to welcome our CS to make his remarks. Thank you.
Which one is this? Is this working? Huh? So, huh? Yes. The chairman of the board of directors of Kenyatta University Teaching, Research and Referral Hospital, the CEO and the top management, PS Medical Service, the acting CEO of Digital Health Agency, the CEO of Social Health Authority, the CEO of Kenya Medical Supplies Agency, and their teams, the CEO of Kenya Medical Practitioners and Dentists Council, Dr. Kariuki, the leadership of the consortium that is working with DHA, distinguished stakeholders, esteemed guests, fellow Kenyans, good morning. It's an honor to join you today as we take a very bold step in transforming Kenya's healthcare system under the leadership of His Excellency President William Ruto and the bottom-up economic transformation agenda. Today marks a milestone in our journey towards universal health coverage by ensuring that every Kenyan, regardless of their income, regardless of their location, have access to affordable, quality, and dignified health care. To deliver on UHC, we are focusing on 4 key pillars. The first one, which is comprehensive integrated health information system. The second one is health commodity security. The third is human resource for health. And the fourth one is health financing. But today we're here for a very important function in our journey as we officially launch 4 critical components of the digital superhighway, a digital ecosystem that forms the backbone of a transparent, patient-centered, and efficient health system. This digital superhighway or digital ecosystem includes of what we are doing today as we roll out the biometric health identification, as we roll out the health professional app called the Practice 360, as we roll out the national product catalog, and finally as we operationalize the health information exchange. On biometric health identification, as provided in Regulation 38 of the Social Health Insurance Regulation 2024, the government of Kenya through SHA is today rolling out biometric identification and verification for all SHA beneficiaries across the country. This innovation will secure access to health services without having physical documents. Your fingerprint will verify your identity securely. This biometric will help us in eliminating fraud and misuse of the benefits. It will also reduce paperwork. It shortens queues of our patients, and it ensures more time is spent on patient care. And this morning I have gone through that process, and I want to confirm to the country that that is what is happening. The time our patients spend is less, and we are spending now more on the care of our patients. To date, SHA has registered 25,143,9 1,987 Kenyans. It has contracted nearly 10,000 hospitals, clinics, and health centers. And since inspection, SHA has reimbursed Kenya shillings 47.5 billion under the Social Health Insurance Fund and 6.9 billion under the Primary Health Care Fund, which is free for all Kenyans accessing health care at level 2 to level 4. Kenyatta University Teaching, Referral and Research Hospital alone, where we are today, has submitted claims over 1.4 billion and has received payments totaling 1 billion. And that tells you that our facilities, both private, public, and faith-based, are seeing value for the investment they have made in healthcare. So biometric registration, as of now, from this minute, is now live in all level 4, 5, and 6 facilities, with ongoing efforts on board level 3 and level 2 facilities across the country. On the health professional app, Practice 360, we are launching today, which is now again live from this minute. It is geo-fenced and geo-tagged to specific health facilities where professionals and most of the healthcare professionals are stationed. This will help us eliminate unauthorized sharing of the pre-authorization approval codes by doctors. All healthcare workers now have an opportunity to view, to approve, and to manage pre-authorization claims and the services they offer directly through Practice 360 app. With immediate effect, SHA will no longer accept OTP-based authorization. Let me make it very clear to our health facilities and to our doctors and other health workers. With immediate effect, SHA will no longer accept OTP-based authorization. All approvals must be completed using either biometric health ID or the Practice app or Practice 360 app. On the National Product Catalog, which we are also launching at the third item, the Ministry officially launches the National Product Catalog, which is fully integrated with the Pharmacy and Poison Board and is now live across all SHA contracted facilities, whether they are public, private, or faith-based. This catalog ensures only authorized, safe, and approved pharmaceutical products are administered to Kenyans, eliminating counterfeit and substandard drugs. All pharmaceutical companies must upload certified products data within 30 days. Failure to comply will result in deregistration and delisting from the SHA ecosystem. Effective immediately, SHA will not or will only reimburse facilities for drugs that are actually dispensed to patients. So if you don't dispense any drug to a patient, then SHA will not reimburse you. If a facility does not stock and a prescription goes unfilled, no reimbursement will be made. And that's why KEMSA is here. Today their fill rate is 57%. In another 1 month, that fill rate will go to 85%. And by November, it will go to 90%, because we have provided all the necessary resources to KEMSA, and they have no choice. They have to join this train. So they must ensure our facilities stock enough drugs. Lastly, on the fully operational health information exchange, Kenya today is joining and is among the first countries in Africa with a fully operational health information exchange, which is enabling real-time, secure data exchange between hospitals, counties, and the national ecosystem. Connected facilities no longer need to submit physical documents for SHA claims. This will eliminate duplicate claims, repeated tests, and billing fraud. Patients charged multiple times for services like X-rays, MRIs, should report to SHA via or through the call center at 147. And I want to repeat that. Kenyan patients who are charged multiple times for services like X-ray or MRI, you have a right now to report to the Social Health Authority through our call center 147. So you don't need to carry those documents. Whichever hospital you visit in any part of our country, the doctor there or the healthcare worker there will see your previous records of the facility you visited. Facilities involved in double billing will be suspended. We are eliminating paper records across all public hospitals. So far, 24 counties are actively transitioning to hospital management information system. By November of 2025, all public hospitals will be fully digital. Every patient encounter, from diagnosis to prescription, will be recorded and tracked in real time. These reforms will stop theft, it will stop manipulation, and it will stop ghost billing in the public system. Every shilling will work for Kenyans who have contributed it. Kenyans can now access their health records through Afya Yangu, the official SHA mobile app and portal. All SHA services, including facility search, claims, coverage, are all accessible in one place. We want to encourage every Kenyan listening to us today to regularly review their Afya Yangu profile. And those who don't have, please upload it on your phone. And report if you see any fraudulent claim in your platform through our call center 147. Ladies and gentlemen, the Ministry of Health is currently testing the track and trace system, which will be launched next month. This will help us monitor pharmaceuticals in real time, from the manufacturer to the wholesaler, to the distributor, to the final patient. And this will help us in order to prevent diversion and counterfeit drugs in our public facilities. It is a key requirement under the Digital Health Act. And once active, we will ensure every tablet and every vial reaches the Kenyan patient it was meant for. The Kenya Medical Practitioners and Dentists Council, who their CEO is here, will leverage on these digital tools to identify and register non-compliant or fraudulent facilities within the Taifa Care Network. Health facilities going forward are expected to uphold strict professionalism, integrity, and accountability. Patient safety and public trust are non-negotiable going forward, and any violation will attract very decisive action. Together, we are building a transparent, efficient, people first health system. Let us keep walking this journey together. Kenya deserves no less. Asanteni sana na Mungu awabariki. I think it's very clear. Before I press the button, is there anybody who has not understood? I think it's very clear. And don't ask me anything outside this. If you want to ask me anything outside this, let's go to Afya House. I'm ready to meet you right now. No, I have come here for a purpose. I'm here to launch biometric. I am here to launch the health professional app. I'm here to launch the national product catalog. And I'm here to watch fully operational health information system. That's why I'm at this hospital. If you have any question on this matter, ask me. If you have any other questions, I am told I have visitors at Afya House. Find me there, I'll answer. And I'm sure you want to ask me about the visitors. The people who are there, I'm going to answer them in Afya House. I don't run away from my visitors. So if it's about here, ask me. If it's not about here, I think everybody has understood it. Am I right? Thank you very much. Anthony, what am I supposed to do? 1, 2. Yeah, that's the launch of the biometric and everything. And you can tell those who are scared. Yes. Thank you very much.